Stroke is disease that affects the vascular supply of the brain part of the brain. Currently, it is amongst the top 5 causes for the mortality and morbidity in America. It occurs when a blood supply to a part of the brain is compromised by a vessel's obstruction or its rupture. Some questions that may come to your mind after learning about strokes. Whether all strokes are similar. What causes a stroke? Why do some people get it and others don't? What are the risks? Warning signs of a stroke. What do stroke patients look like? And what are the complications? What if it happens? Is it treatable? How to avoid a stroke? Whether all strokes are similar. Ischemic stroke. An ischemic stroke is actually due to the blockage of a vessel going to the brain or inside the brain, depriving that particular tissue of its sufficient share of oxygen and nutrients, leading to brain cells beginning to die in minutes. It is a medical emergency and does require immediate treatment. Hemorrhagic stroke. A hemorrhagic stroke is, as its name suggests, due to bleeding inside the brain due to a ruptured vessel, mostly as a result of hypertension. This, again, ultimately results in the tissue not being allowed to get what it needs to stay alive. Transient ischemic attack, mini stroke. A transient ischemic attack (TIA) is when all the symptoms of a stroke are present but are reversed without any treatment within 24 hours. Commonly, it only lasts a few minutes and is a warning sign for an upcoming major stroke. A stroke, also known as a mini-stroke, occurs in 1 to 3 people who have had a TIA in less than a year. Which of the following is the most common type of stroke? As mentioned that all strokes are not the same, and the one related to blockage of vessels in the brain is i.e. Ischemic stroke is 83% versus hemorrhagic stroke, which is only amongst 13% of the people overall who suffer from stroke every year. Which one is dangerous? Generally speaking, it is relatively easier to dissolve a clot with medicine than to stop the bleeding of a vessel inside the brain. That is probably the reason that a hemorrhagic stroke is far more dangerous than an ischemic one with a survival rate of just 26%. On the contrary, in the case of ischemic stroke, more than 50% are fully recovered. What are the causes of strokes? For sure, it depends upon the type of stroke. If it is due to the blockage of a vessel, then it is probably because of the vessel being narrowed by the deposition of fat inside the vessel wall, leading to a narrowed lumen, which is medically called atherosclerosis. Another common cause is a heart with an abnormal rhythm that continuously makes clots of blood and pushes them into the main stream of blood, which by reaching vessels of the brain causes occlusion, as in the case of atherosclerosis. On the contrary, if the stroke type is hemorrhagic, then vessel rupture is either due to the raised blood pressure or due to the already weakened walls of the vessels, due to some connected tissue diseases, like in the case of aneurysms, in which case there is ballooning of vessels that can rupture anytime. Why do some people get IT and others don't? Who is at risk of stroke? Answer is that stroke follows a specific pattern of risk, and not all people are living with the same kind of risks mentioned here, like hypertension, diabetes, obesity, sedentary lifestyle. People who already had episodes of mini strokes, stress, anxiety, and heart diseases. This includes problems like defective heart valves, atrial fibrillation, and heartbeats that are not regular. These issues account for 25% of all strokes. And smoking. In addition to these, some other less important risks are people who use birth control pills, people who are not careful with their cholesterol intake, defective heart valves, as well as atrial fibrillation or irregular heartbeat, which causes 25% of all strokes. 5 stroke warning significances: numbness or weakness in the face, arm, or leg that develops suddenly, especially unilaterally, sudden perplexity or difficulty speaking or understanding and interpreting what is being said. Unilaterally, eyes experience sudden vision impairment, sudden difficulties walking or dizziness, as well as loss of balance or coordination issues. You will hear them say, "I'm suffering from a severe headache that I'm not sure what's causing." What are the most common types of strokes? There is a huge variation in the complaints you will usually see a patient come to you with, but one of the most typical cases you will come across will be a person complaining of a headache, not being able to talk, example aphasia, and one-sided weakness of the body, termed as hemiparesis. Is it treatable? Strokes treatment needs to be started in the shortest possible time, usually within 4 to 6 hours, and its recovery is to be expected within weeks, months, or even years. It has 2 stages. In the first stage, the cause is followed, normal flow is maintained, and in the second stage, the patient goes into rehabilitation, going through various exercises advised by physiotherapists. Stroke was once thought to be an incurable disease, but new advances are allowing people to recover and return to their normal lives. Advances in stroke recovery and rehabilitation. Number 1. Thrombectomy. It's the removal of the blood clot that's holding back the blood flow. This needs to be done within 6 hours of the start of the signs and symptoms. Number 2. Vagus nerve stimulation is essential to help restore the nerves that were affected due to the stroke. Number 3. Repetitive transcranial magnetic stimulation. They work by the same mechanism as vagus stimulation and add up to the strengthening of the nerves. Number 4. The goal of VR is to create a situation in which the patient's neuronal pathways are stimulated and patient's weakened reflexes can be strengthened. Seizures. After a major stroke, a hemorrhagic stroke, or a cerebral cortex-involved stroke, you're more likely to suffer an abrupt seizure within 24 hours. According to a 2018 study, 9.3% of persons who had a stroke had a seizure. Loss of memory. Following instructions may be one of the symptoms of memory loss following a stroke. Having difficulty conducting financial transactions memory loss can be caused by a stroke, but it can also be exacerbated by medications, alcohol, tobacco, and drug abuse, lack of sleep, depression and stress, or poor diet. Vision. Following a stroke, you may experience difficulties with visual processing or making sense of what you see. Visual neglect, also known as spatial inattention, it makes you ignorant of items to your one side. Agnosia. Agnosia is an uncommon neurological condition that develops after a stroke. In this, a person's visual field may struggle to recognize familiar sights. Difficulty with hearing. Sudden sensorineural hearing loss is another name for ear stroke. The patients will lose part or all of their hearing abilities in as little as 3 days. They may endure abrupt dizziness, tinnitus, and earaches in the meanwhile. Muscle weakness. When the parts of the brain that govern muscular movement are damaged by a stroke, the messages between the brain and the muscles are weakened or lost. As a result, the muscles are unable to respond as quickly to the brain's commands, leading to paralysis or weakening. Bed sores. The areas around bone protuberances are frequently affected by pressure sores that may lead to infection and non-healing wounds. Depression. Stroke survivors frequently feel depression. Biochemical changes in the brain are frequently to blame. The survivor of a brain injury may be unable to feel positive feelings. Depression is a common psychological reaction to the disabilities. How to avoid a stroke? Keep an eye on your daily diet, your activities, and your mental health because they all contribute towards this. Your obesity is trapping you in a vicious cycle of sedentary living, which leads to more weight gain and all the depression that comes with obesity and sedentary living. Take care of your circadian rhythm, which is actually a biological clock fitted inside your brain. And the easiest way to take care of that is to sleep well and on time. Don't smoke. Its chemicals have a direct effect on the vessel walls, especially the small vessel walls. Alcohol and cholesterol are also amongst the risk factors, and most especially if you are suffering from hypertension or diabetes mellitus. So be compliant with your medicine and make regular follow-up visits to your concerned physician. This has been a superficial but concise overview of this topic of stroke. If you liked it and want to learn more about your health, we need your support and encouragement. So hit the like button and subscribe for more.